Hello, hello. Welcome to the Effective Cannabis Conversations, where cannabis educators, coaches, medical professionals, scientists, pharmacists, and patients come to share their knowledge and experiences to educate on the health benefits of medical cannabis. Today, we'll be diving into neurological condition, autism, and more. And joining me for today's conversation is colleague Janna Champagne. Hi, Janna. Thank you so much for being our guest editor this month for the neurological issue. And could you please take a few moments and introduce yourself?
Of course, and thanks, Debbie, so much for having me and allowing me to participate as the editor of Effective Cannabis Newsletter this month. I'm super excited, and neurology is something that I specialized in as a nurse. That's in my background, and I also have a daughter with autism and suffer some neurological stuff myself, and I've worked with thousands of patients to help them optimize their cannabis therapy with neurological conditions being one specialty. So, and for background, I am currently working as a professor of cannabinoid medicine at John Patrick University, and I'm teaching functional and integrative medicine students this information and this science that we're failing to teach otherwise in nursing or medical schools. I am founder of 501c3 Autism Safe Haven, which is committed to creating cannabis-inclusive autism care resources. And this is a model that will expand to all patients requiring cannabis-inclusive care. And so we're trailblazing this in Oregon right now and hoping to finally cut the remaining red tape this year to get launched. So that's another big passion. Historically, I was a cannabis patient who happened to be a nurse, and that was really my introduction to cannabis as medicine back in 2012 when I suffered a complete immune collapse and sought cannabis therapy just for pain relief, but it went on to do some really amazing things like reverse my autoimmune lupus labs that were positive on 2 separate labs and now have been negative for more than a decade thanks to cannabis therapy. That really got my attention, and that, of course, was highlighted in last month's Effective Cannabis Newsletter if you want to read more about my testimony. But because that got my attention, I dove into the research, and this is where I began to learn some of the science that they failed to teach us in nursing school. And I learned that they omitted a complete system, like a major system of our body, maybe the main system of our body, the endocannabinoid system, from my anatomy and physiology and pathophysiology courses in nursing school. And so this is where it became kind of an autodidactic journey to really learn about this system and the influence of this system and how it promotes systemic homeostasis. And of course, in pathophysiology, we learned that the underlying cause of all imbalances, of all disease, is imbalances. And the endocannabinoid system promotes balance throughout the body and every other system. So this kind of explains how it did what it did for me in helping to suppress my overactive immune system and reverse my autoimmune lupus. So a few years into my own journey, I began cultivating, working with patients, and through that process began to learn that not all cannabis profiles are equal for all uses. I also experienced with my daughter an autism puberty crisis that led to her having really severe behaviors. She was self-injurious and she was beating everybody up, and she destroyed my home. We had holes in walls, holes for doors, broken windows, pretty severe. And at the time, as a nurse, I did that objective risk versus benefit of cannabis versus the pharmaceuticals for her. And we found that cannabis was a much safer option. And it turned out to be very effective for her as well, and actually spared her out-of-home placement. So lots of passion makers, and it really has driven me to follow cannabis patients' outstanding needs, which are very prolific in the medical community. And that is really what has led to my patient consulting and now my education of medical professionals, my helping patients understand what constitutes optimal therapeutic quality cannabis, and working with different suppliers. And just, I really see education as the key to so many of the barriers that are compromising cannabis patients' ability to have competent medical guidance. And so that's really become my main focus today.
A couple of things I'd like to follow up with you on that you said there. There was so much, but One of the things you talked about is that you tested positive for lupus twice, and then the third time you were negative, or it didn't show that you had it. So how long of a time was it that you were positive? And then how long did it take before you were negative, or you reported as negative?
Yes, I was first diagnosed lupus in the summer of 2012, and it was pretty early on into my health collapse. It was just a few months in that they designated that as one of my diagnostic labels, started me on prednisone and Plaquenil and kind of the usual lupus approach. And so I had been taking those medications for over a year. Started the cannabis therapy in spring of 2013. Like I said, my focus was just not starting opioids. As a nurse, I had seen what happened to patients that were using opioids for chronic pain and knew I wanted to avoid that scenario in my life. So, but it was about 6 months into taking full extract cannabis oil, which is that concentrated extract we get from cannabis flower, that my lupus labs came back negative. So it was about 6 months of intensive cannabis therapy that helped create that seroconversion. And thereafter, I was weaned off of the Plaquenil and the prednisone. And it also spared me my next step in lupus treatment, which is methotrexate.
Have you ever heard of someone that was diagnosed with lupus before and then came back and they said, we don't see the signs that you can be classified as lupus anymore?
Not personally. At that time, I had never heard of autoimmune reversing. And as a nurse, I had been taught that it was a degenerative disease of the immune system, that it's a self-attack by our own immune system against our body's cells. It gets confused and it thinks it's an invader when it's really our own tissue. So oftentimes, and at the time, there was not a lot of information on how to reset autoimmune in the body. Nowadays, cannabis, we have the research that supports that, especially with intensively dosed THC, which is what I was taking, that it can suppress the T cells of the immune system, which is where that self-attack is launched. And so to me, that helped explain why my lupus lab seroconverted, why my self-attack started to decrease. So there is evidence-based information that supports that this is possible. I've heard a lot about people with MS having a lot of luck with cannabis therapy. And then there's other interventions that are being focused on now to help to mitigate autoimmune response as well. And it has a lot to do with focusing on the gut and the microbiome. And of course, cannabis promotes balance in the gut as well. So, it's possible that was part of the mechanism that improved my own health.
It's always interesting to find out how long it takes when someone says that, I was struggling with X, Y, and Z, and then started using cannabis, and now I don't struggle with that. So I think it's important to put those timelines on there, because it's not like you just immediately take something and it fixes everything. It takes time, it takes discovery, and it's also getting to know the medicine yourself. And it actually helps introduce you to yourself in a lot of ways, I say. You get to know yourself better when you really get acquainted with cannabis medically.
Absolutely. And people respond individually. You can't give the same cannabis compound to every person and have them all respond the same way. And so that's really a big key in working with patients, is helping them understand, hey, this is your situation. These are your targets. These are your goals. I understand them, and I have a good idea of what has worked for other patients in your situation and what the research reflects about your condition and your symptoms and how cannabis might help. But we always have this caveat that everybody responds individually. And so if this is not the right combination for you, we can revisit and try some different things and see if we can find a combination of products that work for you. So it's even with thousands of patients experience, helping them and really intensive information. I follow the research very closely. I have hungry brains, so I'm constantly just gobbling up the new info that comes out. Even with that, we still don't have a precise approach that works for every single person.
And I'm not sure we ever will.
No.
And I'm not sure I ever want us to, because I always want to have the natural plant. I think that when we start trying to get to that exact, everybody will respond the same way, this will work the same way, we're not now working with the natural plant and all of its components, which I think is the critical piece to learning about cannabis and your health.
Yeah, and whole plant definitely is best. I'm now also a board certified master herbalist, and it's herbal wisdom that consuming plant medicine in its whole form is always best. And unfortunately, a lot of the processes that are used in the products on our retail cannabis market are stripped way down. They're human altered. Sometimes they're nanodized. Sometimes they're, encapsulated in fat or liposomal. So they do a lot of different things that really strip away the therapeutic value of the whole plant. And it really goes, and the incentive for doing that is not making a better product for patients. The incentive for doing that is being able to patent a single molecule or a combination of molecules from the plant that then they can monopolize the profit off of that. And because Mother Nature holds the patent for whole plants and she's not selling out. That's the only way that they can do the R&D and do all of the research and create this product and make sure that they're the only ones benefiting from the profit from those sales for a designated amount of time before other people can come in and duplicate that. So it's really a profit incentive.
Well, and let me ask you, if you really believe, do you believe, I'll give my input on this after you answer, do you really believe we can create and get to those amazing results that you found, that I found, that your daughter has found through that one molecule example?
I really don't. And I came in with sort of a bias, having been a cultivator. I was working with the whole plant. I knew the plant from seed to harvest. I knew the plant post-harvest through ethanol extraction and making edibles and topicals and tinctures and whatever my patients needed. I was trying to accommodate that. So I was accustomed to those outcomes. And once I entered the cannabis world as an educating nurse, I started working for other companies. And in 2015, I signed on with a CO2 extraction company that was selling cannabis products. And I was working for them as a dosing guide, and saw very quickly that their process changed the way that people responded. And it wasn't just one person. It wasn't just an individual reaction like we talked about. It was every single person I talked to had these really wild responses to this product. And so of course, what did I do? I deep dove again and began researching it. And I found there were studies that actually compared the whole plant versus an isolated molecule from the plant. This was a meta-analysis, so it actually looked at the outcomes of dozens of studies specific to seizures and epilepsy, and what the outcome, when they correlated all the information from all of these outcomes and put the data together, what it reflected was that the whole plant worked just as well at 25 to 30% of the dose of the isolate for managing seizures, with fewer side effects, because isolates do exert more adverse types of effects than the whole plant does. The whole plant beneficial side effects, and people actually seek the plant just for those side effects, even if they're not thinking medicine, right? So clearly it's an improvement there. And then there's other research that supports that whole plant, as you increase the dose, the effect increases pretty predictably, versus when you isolate it, that isolate, it actually exerts a bell curve response in the body. So as you increase the dose, it peaks, and then you keep increasing, and it drops off and stops working. So when you're thinking of these patients that are taking really intensive dosing for autoimmune, for cancer, for autism, they could be on the right side of that bell curve, spending a whole lot of money for intensive dosing of cannabis and getting little to no benefit. So to me, it was very apparent that for my patients and for someone who wasn't benefiting from the sales of any cannabis products at all, that it was my duty to objectively teach them what to seek. So my nurses and I came up with what we called the flow criteria to teach patients what is optimal therapeutic quality. It's flower derived, so this means no biomass hemp. It just doesn't have the potency. We want it lab tested. We want to ensure that potency and purity are known and not just guessed. Hey, this is the strain, this must be what it is. We want to actually see what's in this bottle, right? We want to know what's in here. And then O for organic, because we don't want to be adding toxins to patients that are already sick. That can make or break their response or potentially even cause them harm. And then the W in flow, of course, is for whole plant spectrum. We want to be using products that are ethanol extracted or infused into oil from the whole flower, as this really concentrates the flower as nature intended as closely as possible. And so you have hundreds of compounds in this final product versus with an isolate, it's one compound. With CO2, it's usually a dozen or a couple of dozen. Same thing with distillates. Like they remove the bioflavonoids, the antioxidants, the essential fatty acids, the chlorophyll. This is why some products look like light oil colored or water, is because they've removed a lot of the really beneficial compounds that provide synergy and elevate the cannabinoids and help them to work even better in the body.
And I think a really good way to think about this is thinking about either an apple or an orange and taking it and extracting all the good stuff out of it and just leaving you with one thing or two things. How successful will that fruit be for you if that happens? There's a reason we have the whole fruit. There's a reason we have the whole plant. And it's important to understand the value of that. You're talking about your health and you being diagnosed with lupus and trying to figure this out, but you also mentioned that you have a daughter who has autism. And so I would like to know, and could you share with our listeners, were you dealing with that at the same time and trying to be a caregiver and maneuver a child through this condition? And as you did that, did you realize that cannabis might be of help to her?
Yes, that's sort of how it happened. You know, first it was me seeking cannabis for pain relief and then seeing what it did way beyond what I expected, and then doing the research and understanding its safety profile and understanding the science, understanding how it worked in the body and what it was doing, and just being really comfortable with it as a plant medicine. And it was a couple of years into my own recovery, so I wasn't fully recovered. I had begun cultivating, so I'd begun kind of doing my physical therapy. And I was on my way back, but honestly, my recovery in total took, I mean, it was probably 4 or 5 years before I was back at my fighting weight and feeling strong again and feeling like I was capable of working full time and managing my life. So it took several years. And so it was about 2014 that my daughter entered her puberty crisis. And part of the reason that we were facing out of home placement was because I was still in a weakened position in my life, in my health, and had a hard time managing the physical aspects of her behavior in a safe manner, right? So, when I looked at the medications for autism behaviors, they're antipsychotics, Abilify, Risperidone. They have horrific side effects, quality of life impairing, like male breast development. There's extrapyramidal symptoms, which is uncontrollable movements by the body. There's all kinds of, they can be paradoxical response, meaning they have the opposite reaction, so it can actually make them more psychotic. Plus, there's life-threatening side effects like neuroleptic malignant syndrome and Stevens-Johnson syndrome, and even suicidal ideation, where, once again, like we talked about, cannabis has this unsurpassed safety profile with no harm ever linked with cannabis therapy directly. So to me, that was the natural answer. And as I began to research it further, I also found that autism is linked with an endocannabinoid deficiency of anandamide in the body. And so understanding that, we know that it means that those with autism are not producing enough internal cannabinoids. And when we aren't producing enough internal cannabinoids, we can source and supplement from the cannabinoids in the plant to help seamlessly fill in that deficiency. So cannabis works even deeper with those with autism and other, clinical endocannabinoid deficiencies than just managing the symptoms on the surface level, which is basically where most pharmaceuticals stop. So they don't tend to target the underlying root contributors to those imbalances like cannabis can do. And we have research since, just came out last year with Dr. Bonnie Goldstein, that actually showed that they found a biomarker in the saliva that could help predict, autism versus, the levels they were seeing in the neurotypical cohort. And what they found is when they took these levels in autism and then supplemented with cannabis and then took the levels again on these biomarkers, they saw the autism markers shift towards the neurotypical normal. So we actually are seeing it now on biometrics that are, they're kind of explaining what we see in the research previously, that there's a deficiency, and when we supplement with cannabis, it improves.
So your daughter, at what age when she was when this started? What age is she now? And what have you seen the massive changes or little changes? Because sometimes the little changes are the bigger changes to me that I think that are important that we miss, that you can share.
Of course. So when she began she was in puberty when the crisis began. It was actually a year or two into puberty for her. It was, she went from being this sweet, lovable, very eager to please little girl, very, always laughing, pretty happy, to being diagnosed PMDD, which is basically like homicidal PMS, a very severe form of PMS. And her behaviors looked like I said, she was beating up everybody she could within her reach, anybody in authority. She was self-injuring, so she was punching herself in the head, punching herself in the chest. She was kicking holes in walls, holes through doors, breaking anything she could get her hands on when she would enter these rages that would last 2 to 3 hours per session. And she would rage so hard and so long that she would literally get physically wiped out and pass out at the end of it because she was just exhausted physically. Pretty severe, very stressful, very difficult to manage. We started her with THCA and THC, both in indica formats, which I knew at the time would be more calming, likely for her. And they were also strains that were really good for pain. And in retrospect, I really believe that her behavior was communication because she was still having difficulty with verbal communication at the time. She didn't really start speaking at all until age 10, and that was through a process where we taught her how to type first, and then she started speaking once she could see the words. So it was communication. It was her way of communicating something was wrong. And once we alleviated her pain through the cannabis intervention, the behaviors lifted. And I don't mean to portray that our life is perfect because it is still very challenging, but it's manageable. Cannabis made it manageable for us, to the extent that now she's 22 years of age and would love, she's ready and we're ready for her to be more independent of her parental influences and care, although she is still going to need lifelong intensive care, probably 24/7 care. But she doesn't have eligibility to even look at the licensed care homes in this area that accommodate adults with autism because none of them will allow her cannabis therapy. And so this kind of prompted another mission of mine as the founder of 501c3 Autism Safe Haven, which I know I mentioned earlier. And we're trying to build a licensed care home model where the caregivers are able to actually administer the cannabis according to that resident's care plan. And so that's kind of what we've been trailblazing for that. And part of the reason I'm doing that is having seen the benefits for my daughter, which beyond just her physical comfort, managing her anxiety, managing her self-injury and her pain, helping, her be more comfortable in her world, it really has a profound benefit for the sensory overload that we see with autism as well. So there's a lot of different benefits we see just in the symptom management. And for my daughter, what that translated to was her ability to sit and focus on schoolwork and not feel like she had to aggress or run away or fight it. And so that's when she started academically progressing. And in second grade, she was labeled by the school district as mentally retarded, unable to learn. And we started the cannabis therapy at the same time we were homeschooling because I didn't believe the school district and I thought I could prove them wrong. And thankfully we did. We found a teacher who saw her potential through homeschooling and figured out how to test what she knew, because that was one of our big challenges. In 2021, she graduated high school as a fifth-year senior with a full high school diploma. So that was one of the other side benefits that we saw of just being able to manage her symptoms and help her focus and help her be comfortable in her own skin, was that she was better able to show us her academic abilities.
Wow, that's amazing that you've been able to accomplish all of that for her and for yourself, for your family. But that is something that everyone that has a child that has any autistic characteristics should know. They have the right to have that information. I don't think they should be left from getting that. And that's what is so critical, because this is something that many families are struggling with and living with today and trying to cope with. And knowing that there's that access out there and there are people out there that have been through this that can help you, that are educated on this, is so important. So congratulations on helping your daughter, and congratulations on your daughter doing such amazing work, because it is work on her part. It's work on your part. And with that, I would just like to ask, I know that cannabis helped you with your health issues, and I know cannabis helps your daughter with hers. How about cannabis helping you to manage the situation that you're dealing with your daughter? This is something we don't talk about enough, is how cannabis helps us cope with very trying things that are happening in our life sometimes.
For sure, for sure. And it's actually theorized that autism parents, especially those of children with severe autism, have stress levels that equate to those of combat soldiers. So PTSD is real. And I do believe that cannabis can be a helper for parents that are experiencing these traumatic events, help them to process and release and heal some of those wounds that come just through this experience. I do believe that there's a big piece of that for parents that can benefit. And this probably explains why tens of thousands of families who have an autism loved one are using cannabis in the United States today. It's not a rare thing. I know we don't hear about it a ton, but it's really difficult for these families to step forward and step up. Some of them are not in locations where they should be using cannabis for their kids. Some of them are risking everything just because they see how much it helps their kid. And oftentimes these families have tried every pharmaceutical and nothing else is working. And the cannabis comes in and provides them relief. And so I do a lot of counseling of the parents as well, and kind of teaching, how to work through. And first it starts with, when they're on that ledge and on that family is in crisis because the child's behaving and they're not sleeping. Man, the sleep deprivation piece alone is so high impact for families. But once the cannabis starts to help their child, they can all kind of back away from that cliff that we call autism puberty crisis. They can all kind of back away from it and take a breath and get some perspective. And at that point, they can start, once you have hope that there's answers and hope that things can get better, you tend to start looking for more answers. Because I'll say, although cannabis is a wonderful tool for autism, I don't ever portray it as the one and only thing that should be utilized. I feel like there's so many other things we can do to benefit those with autism, including the various therapies. My daughter, I know ABA is kind of controversial now, but my daughter benefited greatly from ABA therapy. She had occupational therapy, she had speech therapy, she had, a special ed teacher homeschooling her. We also have done a lot of other biomedical treatments for her, nutrigenomics and supplements, and thankfully she's not on a lot of pharmaceuticals, just antihistamines and mast cell stabilizers to help decrease her histamine load. But that's it as far as medications. So, and then diet is so huge, and improving the gut health in autism can be so high impact. So to me, it can open up these doors and help parents manage their life, and then look at what else can we do to make it even more manageable. Just getting them to that point where they can take a breath and then be able to think again and look again. And then kind of where we are now, the way I look at it retrospectively is that I found purpose in our traumatic experiences. And my purpose is to take what I learned through all of those years of trauma that and there's so much more to the story even than we're touching on today. But to take that and use that knowledge to help other people, to me, that's been the most healing part. So I always encourage families that just keep swimming, and at some point you're going to get to a level where you have a good enough handle on it and you've learned enough and your child is stable enough that if you want to utilize that knowledge to help other people, you should do that if you have that inclination at all. Because that, to me, it's almost selfish. It really has been one of the biggest parts of my own healing from everything. So,
well, and I think the key word there that you said is hope. Having hope. Because you said earlier that the doctor said there wasn't really anything that they could do. They didn't know what to do. And you didn't feel like you had hope. And cannabis opened that door and gave you hope. And with that hope, then you went off and discovered, studied, researched to get to where you are, spoke to whoever you needed to that had information that you were looking for. So anybody that's struggling with any health condition, the key is they need hope. And cannabis is opening that door for a lot of health conditions, and especially in the neurological realm. There's a lot of issues that we're finding that cannabis is beneficial for. So I think that just having these conversations, even if you don't have the mission to go out and do what, say, Janna and I do, but just to have the conversation and share that information with someone else is key enough to help bring this forward, to make sure that people have the access to this information. That's really important.
our stories are powerful. They really are. We can bring hope to others through our own stories. And
Yes.
that's why we have our testimonies every month.
Yes, exactly. So you talked a lot about some traditional medicines and cannabis. Can you kind of talk about where the comparison between pharmaceuticals and cannabis as far as using it, how you go about it? So, when we get a pharmaceutical, you're told to take it X number of hours, so much apart, whatever. And these are the symptoms that you're going to get, pay attention to them. Can you kind of give a comparison, a regimen of using a pharmaceutical versus using a cannabis medical derived product to help with a medical condition?
Yeah, the approach differs completely. And this is part of why, combined with the fact that we're not teaching endocannabinoid or cannabinoid science in medical schools, why the mainstream medical system has such a hard time grasping cannabis and the endocannabinoid system, because it completely shifts the paradigm that they're accustomed to, which is you have a prescription, you write out the chemical compound, the potency, the dosage, the route, the timing, all these things that are kind of a typical part of a prescription. And you go to the pharmacy and they fill it for you, and it's all very standardized. In the cannabis industry, with cannabis, and part of what I try to do with medical professionals is remind them that it's first and foremost a plant medicine. As an herbalist, we approach plant medicine very differently. And it's, helping patients choose a profile that might benefit their specific situation based on what we know through the research, evidence-based information, also through patient case studies and what has actually helped patients in their situation. And through that, we take our best guess at starting with a product that might fit their needs. We have them start slowly, increase slowly, and then stop where they feel good. And then the wonderful thing about cannabis, because the dosing is so individual, and what's going to work for a person is so individual, there's always this experimentation process where they're trying different things and they're journaling it, and they're really trying to hone in on something they can take every single day, whether it be in capsules or tincture or however, in a concentrate, that will help keep their symptoms manageable. But then we also teach that it's very flexible. And if they have a day that they have higher symptoms of, say, pain, they can take extra. But we also want to make sure that they understand how to space it around any pharmaceuticals they're continuing to take, because interactions are actually, or the potential for interactions between cannabis and pharmaceuticals is probably the main risk factor, because cannabis can either cancel out or make pharmaceuticals stronger depending on how it interacts. And it, these are pharmaceuticals that are using the same metabolic pathway. So this is part of what we should be doing as medical professionals, is guiding patients through this well-informed process. Unfortunately, it's rare that this happens. In Oregon, patients go to a doctor to be registered for the Oregon Medical Marijuana Program. They walk away with a signature. They very rarely get any guidance. And these doctors, most doctors don't have time to guide. They maybe have 15 minutes with their patient. That's not ample. So it's not, and the fact that most haven't been taught this information either. They're not competent to guide these patients. So this is really where we have to step it up. And I've been talking a lot about how we need to be educating our medical professionals. We need to have resources for our patients so that they're not just going to the dispensary and eeny, meeny, miny, mo, or following an unmedically trained bud tender's advice about what product might be the best fit for them. So we still have a lot of work to do. But I know that there are many of us like yourself, Debbie, that are committed to helping patients understand this information and understand the optimal therapeutic approach. And it looks very different from what is happening in most medical states, unfortunately.
Are there specific cannabinoid therapies or formulations that are particularly effective with autism, or have you seen a wide variety?
Well, autism is such a big umbrella. It's a spectrum disorder. So we have everything from the very severe nonverbal high behavior, kind of lower functioning, to very high functioning, high intelligence, maybe some social anxiety or social awkwardness, and kind of everything in between. So even, things like PDD-NOS, which is a developmental disability label, or ADHD are kind of considered to be part of the autism spectrum. So it's always a very individualized approach, whether autism or another diagnosis. And it's about figuring out what are their goals, what are their symptoms, what's their priority, because they may have 10 symptoms and one is all day, every day, and the other one is once in a while. Well, of course, you're going to prioritize the one that's more problematic. And taking a symptom-driven approach with cannabis therapy is a great way to go, especially when there's not a lot of research on a specific condition. So with autism, oftentimes we're looking to reduce sensory onslaught. We're looking to calm, or, a lot of times there's anxiety. We're looking to kind of reduce that stimulation. And so indicas tend to be a great fit for those types of autism, versus someone with ADHD that benefits from stimulant therapy, Ritalin or Adderall. A more sativa type of blend might be more optimal for them. And through some of the product companies I collaborate with, I actually have helped them create specific targeted formulations for things like autism or anxiety or ADHD or depression. And so neuro-targeted, we like seeing some myrcene in there. Myrcene is a terpene produced by the cannabis plant that helps it to cross the blood-brain barrier. So anytime you have something neurological happening, look for myrcene in that lab test. That's going to be a good fit. But as far as let's see, linalool is another good one for autism. It tends to be really calming. It's also found in lavender. It's anxiolytic. So once again, it just kind of depends on the kiddo. Sometimes it's beta-carotene for the CB2 targeting, because we do have research supporting that, autism comes with brain inflammation. When the brain is inflamed, the CB2 receptors upregulate, which means the body is asking for either beta-carotene or CBG, right? Those are the CB2 agonists. So kind of depending on, is it somebody that's prone to anxiety and already kind of on an elevated energy scale? We probably want to go with the beta-carotene that's going to be more calming, more sedative to neutral, versus the CBG, which tends to be more stimulating. So there's ways like that that we can kind of tweak and hone in on which specific formulation might be the best fit for that patient. But even then, I always explain this caveat that we're making our best educated guess. This may or may not be the best protocol for you. We may need to come back and tweak some things. We may need to change products out. But the way that we know that is based on that individual's response. So it's a trial and error process.
it's a trial and error process for sure, but it's also an awakening to knowing yourself and getting acquainted with yourself and how you're responding to these formulations. I think that's, again, another place that we don't spend enough time talking about, because we've been so trained to just take a pharmaceutical. This is the list of conditions, symptoms that you can develop. When you develop this list, call the doctor. If you develop this list, just it'll go away over a period of time. And when we're talking about cannabinoid therapies and introducing them, it's really about listening to your body, getting to understand it, and being aware of what it's happening. And that's not something that we're really taught. So I think that's a really great thing that we need to be discussing and talking about on a more regular basis.
Sure. And I have people ask me my daughter's protocol, and it's, I mean, we're a decade in. So it's TH3, 3 capsules a day. She gets THCA twice a day. She gets beta-carophylline twice a day. She gets a targeted pain formula and a targeted anxiety formula in the morning. And then she gets a night pain formula and CBN added at night. And then, you know, with autism, every day can look different. One day she can wake up and she's happy and great and having a great day. And another day she's waking up crying and screaming and kicking. So, you know, depending on how she presents, there's the flexibility to add additional cannabinoids and other interventions during the day for her, if that's where she's at and that's the support she requires. So I always just encourage parents to be really flexible about it. Figure out what works for your kid for a specific symptom. When your kid shows that symptom, use that product. Work around the pharmaceuticals. It can be that simple. So.
And I say that's the most freeing thing that I've experienced with using cannabis, is that I get to decide when I need to take again. I'm not driven by a set of rules that you can only take this every 12 hours or you can only take this once a day. But oh my gosh, the symptoms have just got so out of control. I don't know how to manage them. And as a parent, I would think, dealing with that situation, you're grasping for anything to help you in those difficult moments. And when you're given a pharmaceutical and you're said, well, I'm sorry, you can't do it again, you just have to wait. What are you supposed to do with that? And how do you manage that versus when you can say, oh, I know this will help, this cannabinoid and these terpenes would really help in this moment. And it's not going to harm her or cause any damage. So let's do this. And then you can see the benefits. Is that not a much better way to be dealing with health?
And it definitely helps alleviate things quickly. So we use sublingual a lot with my daughter. Once in a while, if it's PMS week, we might use the inhalants a little more frequently, but just how quickly it can alleviate the situation. And then as a parent, I teach other parents, if you wake up and it starts off as a really hard day, get it managed. And as soon as things have calmed down, go take 10 minutes for yourself and do what you need to do to reset. For me, my answer is meditation. I find a quiet spot and I meditate and I reset my day. So I teach, that's such an important tool to be able to, you know, minimize the impact of those hard moments. It's to very quickly as possible, get it remedied and put it behind you and release it, let it go, reset, psh, done, new day. So that's been a big key for us as well.
That's awesome. I think that's a very good tip to give to everyone, no matter what they're dealing with, to be honest. Just reset, go meditate and reset for a few minutes.
Yeah, it's stress management, which is also very important. And it's something I teach every patient I work with. And it's so funny because on my intake form, it says, how do you manage your stress? And most people either don't answer it. And then when I ask them in person, it's crickets, like, oh, that wasn't a trick question. So,
well,
yeah, realistically, if we're managing our stress, it gives the cannabis the opportunity to do deeper work. Because when you take cannabis, that's the first thing it's going to do is mitigate your stress response. So if you're taking care of that, it gives it the opportunity to do more for you.
Well, I think, you know, you were talking about your daughter taking these different, you know, taking tablets 3 times a day, taking an oil, taking a salve. And I think that in general, most people think when we say, you know, you go to cannabis, you're just going to take it one thing. And that's not true. There's very many different forms that you can use it, and you can use it throughout the day. And it's not going to be harmful, because I'm sure there's people sitting here wondering, well, is your daughter high? Because that's the first thing you said, that she takes you started with THC. And it's like people are so afraid of THC and afraid that they're going to get high, especially when they're talking about a child. So could you just talk a little bit about that?
Sure. And so if a child, there are considerations, serious considerations about the use of THC in childhood and adolescence. That's not something I've just blown off and have disregarded. It's there, it's present. Every patient of mine that's pediatric, we talk about it. We talk about, is there a family predisposition to schizophrenia, or is there genetic predisposition to schizophrenia? So other than that potential, which is very rare, it's 2% of the population that really is contraindicated to take THC. So it's a very small portion of us. So beyond that, there is research that there's also research saying the opposite. So it's still kind of a gray area, but there is research reflecting that childhood or adolescent use of THC can cause neurodevelopmental issues later in life. So we know that that's a risk factor. If a child or an adolescent is using THC medically, their problems far surpass that of the potential for neurodevelopmental issues. It's usually life-threatening, like cancer, or some mental health disorders that are causing these kids harm or harming themselves, or potential for harm. Autism, same thing. There's immense potential for harm. And oftentimes these kids have endocannabinoid deficiency. Clearly, if they're sick, their body is not keeping up with the imbalances appropriately. So because of the extent of their deficiency, when we administer cannabis, even THC, it's just filling in for that deficiency and bringing them to a normal threshold. And so oftentimes they don't show any intoxication for, the first quite a while, because we're just filling in for what's missing. We're not providing anything in excess. And it's when you tip that threshold of THC tolerance that you see the intoxication. So my daughter's been using THC for a decade, and it's a handful of times that I've seen her show any discernible high. And she takes pretty large amounts of THC.
And when you say concernable high, can you explain a little bit about what that looks like?
Sure. So for her, the discernible high looks like she slows down a little bit in her movements and her eyes get red and bloodshot and kind of droopy, or she's just moving a little more slowly. Sometimes she's a little giggly. It's not unpleasant for her at all. And like I said, it's only happened a couple of times. Usually you give her THC and what you see is an improvement in her comfort, an improvement in her existence, which any autism parent, that's our goal, is just to improve our kids' existence overall. Like these are tortured little kids that, they're misunderstood. They have a hard time communicating what is bothering them, and they're kind of trapped in their own bodies sometimes. So it's really, it's really a wonderful thing to be able to bring them some comfort. They deserve it.
Absolutely. And I always find it interesting that, talking about pharmaceuticals and cannabis and doing comparisons and considerations, that I used to work in oncology in the labs and diagnosing cancer patients and working with them, and had many children with leukemia and other health conditions. And parents were just so happy to have something that they thought would save or prolong their child's life. They did, I don't even remember them saying much about what are the side effects or the things that we need to be worried about. It's more about how many more years will we get. And I find it interesting that we don't usually know for about 20 years, once we started using chemo on children, what the side effects were long term. And we've been using cannabis forever. It's been around forever. And we do not have anything that shows that it is like so harmful that it's going to cause serious harm to your kids or to you as an individual. Everything is still a little bit questionable about what are the risks and what are the problems that we run into, long term. We don't know that yet. But I don't, when we're talking about it affecting kids' memory and their neurological growth, we're still studying that because we just started learning about this in the 1990s. So it's not like we have a big long history behind this research. So it's, I just ask you to be open to the fact that cannabis has been using forever, and we don't have anyone that's ever died. And that, if it could provide relief for your child and for your family, or for anyone that you love or care about, isn't it worth trying?
Absolutely. And it's really just the THC that we're concerned about, which is one of, more than 165 cannabinoids produced by the cannabis plant. So if a parent is really concerned and absolutely no THC, there's lots of other options. And even if they do, like with cancer, THC can be an important aspect of their protocol. But if they take too much THC and they become uncomfortably high, because there is that part of the threshold too, where you become nauseous and probably vomit and get vertigo and, uncomfortably intoxicated. Well, we can have them administer a little bit of CBD and it helps reduce that intoxication. So we have tools if that scenario does happen. But hopefully through our guidance where we're saying start low, increase slowly, watch the tolerance level, listen to their response, and follow that, dose accordingly. If they happen to not listen to that and become intoxicated, there's still a way to help reduce it. So it's, it's really not as scary as people make it out to be. Like you said, unsurpassed safety profile, more than 5,000 years of human use across the lifespan from infancy to end of life. No deaths ever attributed to cannabis therapy.
Right.
So it's, compared to most pharmaceuticals can't boast that the side effects are mild and benign like cannabis can.
Right. And a lot of people have serious reactions to pharmaceuticals. We don't see that with cannabis because.
And it's the whole plant form that's really key there too, because if you isolate a cannabinoid, it's going to act a lot like a pharmaceutical. You're going to see heightened risk factors and heightened side effects. We know this.
Right.
But when it's in that whole plant form, there's more synergy and it works with your body more gently. It's almost like the difference between somebody injecting you with something versus offering you a table of things to choose from that you can pick and choose what you like. So it's very, very forceful versus very passive offering. That's the way that plant medicine works, is it's more of an offering to the body, and the body uptakes what it needs and excretes what it doesn't. Versus an isolate, it's going to like go into those receptors and force itself into the cell, whether it's needed or not.
Great point. So as we wind up here, I'd like to ask two final questions. Looking ahead, what advancements and developments would you like to see or anticipate in medical cannabis in treating autism and all neurological conditions?
I was first asked this question in a 2016 interview, my first interview in the cannabis industry. And my answer remains the same as it was in 2016. We need human trials. I'll keep saying that same answer every time I'm asked. It's ridiculous that we're not doing human trials with cannabis therapy, especially considering its unsurpassed safety profile and low potential for risk and high potential for benefit. The bureaucracy is just pretty thick still around this issue. And there are a few human trials that have happened. Most of them are retrospective case studies. There are some that are active human trials, but once again, they're having to use the product that the government furnishes out of the University of Mississippi, which has been wrought with issues. Dr. Sue Sisley talked about how she was doing a study, I think it was on PTSD and cannabis.
Yeah.
Veterans, and the product she got from the government was full of mold. So it's exceedingly difficult to get really standardized human outcomes with cannabis therapy. And this is part of why I teach that patient outcomes and case studies are evidence, because that's the closest thing we have to standardized human trials and research.
Well, and from my own research that I do, I interview a lot of people based on specific medical conditions, like I'm interviewing you here. And so I've really focused in on lung health and the benefits of using cannabis for lung health, whether it be COPD, emphysema, MAC lung disease, quite a few. And there are similarities within all of those that are using cannabinoid therapies that we can find similarities. And so I think that the human research, just from firsthand stories and testimonials, tells us a lot if we ask the right questions in the right way to garner where they're coming from and what they've got. It takes a lot of documenting, but I think we have it. And that's one of the things that I hope with the newsletter that we're starting to build, is that we're building that inventory of that, so you can go back and look at firsthand stories under this topic and what cannabinoids were being used, what terpenes were being used, what results were being received, and how long it took, whatever. There's a whole bunch of information there. So I do believe we have it. I personally don't have time for traditional studies to come along for my health, I don't think, at my age, and get the end result, as long as they take sometimes. And when we think about it, there's so many health conditions that cannabis can help, that thinking that we're going to research all of those in the same time period and get everybody up to speed is really not possible or feasible. So that's why firsthand stories and you coming and sharing your story and your daughter's story becomes so important.
Yeah, I agree.
So is there any one thing that I did not ask you today that you think that the audience needs to know?
Goodness, we covered a lot today, didn't we?
Yes.
I think that's pretty much everything. You know, I just encourage all of you to keep learning and share your knowledge. This is how we're going to get this information out there to help more patients find this solution to their health. If you'd like to reach out to me or get into contact, I'm sure this will be a link under the video as well. You can visit my Media Kit website, which is jannachampagne.com, spelled just like my name. And there's kind of a list of all of my roles on there with links to different things and a contact me form. So I'm happy to be in contact if there's anything I can do to help. I'm a big follower of patient needs. So if a patient needs something, I have a hard time saying no. But yeah, I would love to hear from you guys, and I hope you all enjoyed the May edition of the Effective Cannabis newsletter that I will be editing. So I look forward to that as well.
Well, thank you, Janna. We really appreciate you taking the time to speak with us today and share your knowledge and enlighten our listeners with some information that I'm pretty sure they might not have heard before. And also, congratulations on all the work that you're doing. And we know that every voice matters and is important when we're talking in this space. So everyone needs to use their voice to at least share. I don't care if you share it with just one person today, that there is a chance that cannabis could help you, or you should at least learn about your ECS. Everyone should know about their ECS. And they should know that they were born with it and it plays a role in their life. So if nothing else, share that today. So thank you for being here, and we really appreciate it.
Thank you for having me. This was a lot of fun. Thanks, Debbie.
Thanks.
We so appreciate you dropping in. Your time and support are invaluable as we strive to educate and advocate for the transformative potential of medical cannabis. Remember, you have only one health and one life, and no one lives them but you. Let's continue this journey together. Subscribe and hit the bell icon to stay updated on our latest conversations. Your comments and engagement fuel the dialogue we need to create change. Until next time, stay empowered and keep exploring the wonders of your endocannabinoid system. Stay uplifted, stay curious.